Hi, I'm Lisa Prather, and welcome to The Voice of Health with our host, Dr. Robert Prather of the Prather Practice, where lives are changed every day through the natural approach to healthcare. Well, today we're talking about shining the light on Lyme's disease. And there seems to be a lot of interest and hype. Why all the interest, Dr. Prather, in Lyme's disease right now?
Lyme's disease is the number one vector-borne disease, which means that it's spread by either mosquitoes or ticks, or in this case ticks. So it is the number one reported disease right now, and the number 6 reported disease in America at this point. So there is quite a bit of actual patients who have Lyme's disease. So it is a big problem, but it has hit the internet quite a bit. And one of the things one of the things I hear quite a bit is, doctor, do you think I happen to have Lyme's disease?
Lyme's disease.
And I'm sure a lot of doctors are hearing that. And, there is a, don't do it outwardly, but there is a inward roll of the eyes. Because it has become sort of a popular type of thing. In other words, there's a lot of people who are thinking that they have Lyme's disease that have no way of actually having it. So there is a popularity around it. It is an easy disease to kind of say. The Lyme's. There's a lot of hype on the internet on it. There's a tremendous number of YouTube videos on people who are talking about their Lyme's. And there's a lot of people out there who actually have Lyme's disease who have gotten on and talked about it, and there's people who have brought it up. But there's a lot of confusion. There's a lot of concern, with Lyme's disease, and it is a major issue, but it's not quite as much of a major issue as some people are thinking. In other words, there's different types of spectrums from A to Z on this whole aspect.
Right. Well, how is Lyme's disease tested?
Well, Lyme's disease does have a set pattern. There's a 2-tier type of a blood test. It is a blood test to check to see on the reactions of it. There are a lot of other different types of tests that are out there that are not approved by the Center of Disease Control as being accurate for testing for Lyme's disease. Now, the way that they test it, the best that they can do, is it doesn't necessarily always pick up accurately. So there's a problem with it.
With the testing? With
the testing, because it's not 100% accurate. In other words, it gives you an indication that you have it. It's about 70% accurate. So it leads to a lot of speculation. You know what I'm saying? In other words, there are people who later on found out that they had Lyme's disease, and they were tested for it, and they were told that they didn't have it. So, when you get on the internet and say that, people go, aha, And then there's a lot of people who are putting out that we have the accurate test for Lyme's disease. And when they do test it against, in scientific types of studies, they find that that's not necessarily the case. And then there are a lot of other different types of infections. And even as you're talking about Lyme's disease, there's a lot of different forms of Lyme's disease. There's a lot of infections that imitate Lyme's disease. So I've had people who are diagnosed with Lyme's disease and didn't have Lyme's disease, the Borrelia infection, Burgdorfera. We won't be saying that very often.
Or spelling it.
That is the...
didn't you have someone coming from Illinois that they were saying he had Lyme and it wasn't Lyme's disease?
Yes. So I've had several people who had been diagnosed with Lyme's disease and didn't have it. I had one patient who came in who had been treated for Lyme's disease for 3 years. Came from the East Coast, which is a heavy Lyme's area. And they came in a wheelchair with an IV on the
And they've been treated 3 years.
They had been treated 3 years and 2 years of antibiotics, and the patient was getting worse and worse and worse, which is a sign that you know that if you're treated for something and you're getting worse for it, you probably don't have it. Mm-hmm. So, we did some testing, and they said that, they had Lyme's disease, and I go, well, let's, the tests that are accepted did not prove positive. She said, well, I went to another different type of a test that's not accepted by the CDC that is more accurate. And one of the things that they didn't tell it is that can also be the test. I understand the test and how it works, but what they really had was a parasitic infection. So, we did thorough testing. We didn't discount because we understand we've had Lyme's patients. We know how devastating it can be. Mm-hmm. But it didn't really follow the pattern of what was going on. And the long-term antibiotic treatment was contraindicated for the particular problem that they had because it was wiping out the normal bacteria, so it was weakening the patient and was making the problem much, much worse. So once we found out what it was that the person had, started them on the proper regimen along those lines, there was an immediate difference. In other words, that they could really see the difference, and within a year's time, the patient was well.
Yeah, and you said how accurate is the testing? Not very accurate.
Well, I mean, it's not as accurate as
you said 70%.
70% accurate.
Wow,
is a good number, and so it creates a lot of confusion. Yes. Among the public. It creates a lot of confusion among doctors. There is if a doctor sits there and you have about 20 people come in and say, Doc, do I have Lyme's disease? Mm-hmm. You start rolling your eyes a little bit. So I
actually saw that at our vet, his front office gal. Uh-huh. Said she told me she had Lyme's disease, and he was behind her rolling his eyes. Yeah. She does not have Lyme's disease.
And I've had some patients who told me, well, I found out what my problem is, doctor. I've gone and had Lyme, tested for Lyme's, and there was no way that the person had Lyme's. Mm-hmm. Do you know what I mean? So
why do people want Lyme's disease?
People are struggling. They've got different types of things with different types of health issues.
They're trying to find a diagnosis.
And they're trying to find something that they could pin their problems on, because otherwise, you're not really taken seriously. Mm-hmm. You're considered, well, it's in your head. Mm-hmm. You know what I mean? Mm-hmm. People are discounted. So if you have something to hang it on, and then people go, ooh, I've heard Lyme's disease is serious, you poor thing. Mm-hmm. So it's a validation.
Right.
And that's one of the things, and if you sit there and tell people that they have Giardia, it doesn't have the same
if you could have Giardia or Lyme.
People go, a what?
And then you describe it.
Yeah. So, it's not as as well known.
And we're not saying there are Lyme's disease cases.
Oh, absolutely.
It's just misdiagnosed.
And I've had Lyme's disease cases. Mm-hmm. That it's a very, very devastating disease, and it should be taken very seriously. And, the problem goes both ways. Mm-hmm. Because you have people who are looking to hang their hat on something. Mm-hmm. Lyme's disease is a very accepted, very popular, very sympathetic type of a disease that's going on at this time. But there are people who have Lyme's disease who have been completely discounted by their doctors. And because the doctor has heard it so many times and it's popular, then they don't even look into it necessarily, but are dismissed as a patient. Mm-hmm. So, the whole thing that a doctor needs to do is to be open-minded, be willing to test. If you don't test, you don't know.
Right.
And be very familiar with the signs and symptoms of the, in other words, you're putting together a total picture. There's a detective work and an investigation in any type of a health type of situation. And one of the things that's interesting about Lyme's patients is, one of my Lyme's patients had 4 different types of infections going on at the same time. Mm-hmm. The Borrelia was which is the active form of the Lyme's, the infection. But they also had some other different types of tick-borne infections. So when the tick bit them, it wasn't just transmitting the Borrelia, but it was actually also transmitting 3 other different types of infections. Mm. Understanding that and then working with that and being willing to go a little bit further helped us to really solve that case.
Right. And it's all about being, a detective as a doctor. Very important. So how common is Lyme's disease?
Well, Lyme's disease, it depends on quite a bit on where you are.
Geographically. Where you live.
Yeah, there's about 30,000 new cases a year of Lyme's. Hmm. So, that's one of the things that is definitely going on. It probably could be a little bit more than that because some of them aren't reported. And just because you were bit by a tick with the Borrelia infection doesn't necessarily mean even that you're going to get Lyme's. Hmm. So there's a whole factor along those lines. There's your resistance. In other words, there's more to infection than just exposure. So as you're talking about, where people are actually getting it, if you live in Connecticut in 2015, there was 1,873 confirmed cases.
What does Indiana look like?
Indiana, on the other hand, had 102.
Big difference. So does the East Coast
get
hit more?
The first place that they found the Lyme's disease was in Lyme, Connecticut. Mm-hmm. And that was sort of the epicenter.
Oh, okay.
Epicenter
That's where
of the
name
infection.
Came from.
That's where the name came from.
Yeah, because I'm looking at these stats. All East Coast, Massachusetts was 1,300. Interesting.
Yeah.
New York.
Actually, in Massachusetts in 2014, mm-hmm. and then 2015, it was 2,900.
Right.
So, it depends a lot on where you are. And different types of ticks transmit it, some don't.
Okay, when we come back, let's talk about the symptoms of Lyme's disease. You can win a free 60-minute massage in a relaxing spa at the Prather Practice. Each month, we have a drawing to give away a free massage to one of our lucky Facebook and Twitter fans. Follow us on Facebook and Twitter on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather Practice. Why did you incorporate massage into your practice?
I believe that massage is an extremely important part of one's wellness, health regimen. It's something that everyone should have done at least once a month, if not more often, just to maintain a good, healthy type of a program in their system. As you work with the muscles and the soft tissue, you can actually create a tremendous amount of changes that occur. There are hormonal changes, there are physiological changes on balance. It's a very important part of one's health and wellness.
Yeah, it's much more than
and
just feeling good. Well, it feels good, yeah. It's a lot more. What types of massage services do you do at your office?
Well, interestingly enough, there are a lot of different ways that massage actually can be involved in someone's health, and people don't realize how many types of massage there actually are. There's lymphatic, there's muscle, there's deep muscle, there's reflexology, there's electromagnetic, there's neurological, there's ones that can actually wake you up, some that can relax you, some that can balance out your emotional states. So there's a tremendous amount of different types of massage that can be affected on your system.
And who would benefit from massage?
Everyone. But if you have tight muscles, and I'm sure most people out there don't, a higher than average stress level, then massage can really prolong your life, reduce your blood pressure, increase your chances of preventing cardiovascular and cancer, especially if you're in a high stress position. Definitely take the time out for massage.
Here we have member pricing for our spa services for once a month massage at $59 a month.
Wow.
Which is great.
That is good.
Our massage therapist, we have from 11 years experience to 25 years experience with our massage therapist. So,
Yeah.
and there's nowhere else in town that you can get that kind of quality, massage for that price.
It is a medical level massage at that's a very good price.
$59.
Yeah. We also have a medical doctor on staff, nurse practitioner, chiropractic, acupuncture. We have all the diagnostics here so that, you can feel very assured that you have the support, of a whole healthcare professional team that is behind the massage therapist too.
Schedule your appointment at the Prather Practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope.
And I'm feeling good.
You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, the most comprehensive wellness center in the Midwest. We're talking today about shining the light on Lyme's disease. And, we don't want to take this lightly. We're talking about, a lot of times it's misdiagnosed. But we had an incident here in Plainfield, Indiana, a little toddler who died after a tick bite. Mm-hmm. And our hearts go out and our prayers to the family. That has to be devastating. And, you and I were talking about it because, I made it sound like she had died from Lyme's disease.
And that was your first thought?
Yeah, and I think I make the connection, tick bite, Lyme's disease.
Correct.
But you're saying, here in Indiana especially, what do you find when a person gets a tick bite?
Well, the thing that I've treated the most is Rickettsia, which is Rocky Mountain spotted fever, and that is what they feel was the disease that was going on with this particular child, the infection. And Rickettsia can be a very dangerous type of thing. I've had several patients with that. Matter of fact, I had a incident where there were 4 guys, older gentlemen, who were hunting partners. And one of them had come down with an infection and was treated, and pretty soon he wasn't doing well, and pretty soon the next guy came down with the infection, and the third one started to get some of the symptoms too, and eventually all 4 of them started to have the same symptoms. And the second guy who came down with the symptoms didn't like how it was going for the first guy. So he had come to me, started the treatments. I had done some diagnosis on him and had diagnosed him with Rickettsia, which is more in southern Illinois, southern Indiana. And we've had several people from there, especially hunters, we're out there, can get to tick bites, that type of thing. And he had also had the same doctor, and they were talking to him, and the doctor was very upset that he was coming to me instead of the other gentleman, to him. And he says, well, it's not going very well for the first guy, so I want to try something different. And he had started to see some difference, and the first guy actually died. And he had visited with the other doctor, and he says, well, it's not real promising, on what was going on here, with the treatments. And he was very much against the diagnosis of Rickettsia. Even though he had all the signs and symptoms, he did not show up positive for the blood test for it. But the signs, symptoms, everything else like that was so much in line that I went with my gut on the diagnosis. Everything else was showing up positive. The long story of it short is that all 4 guys came down with it. The only one who got treated at our office was the only one who survived.
Wow.
And
what was the difference?
The difference was our approach. Well, first off, you have to start out with the right diagnosis. The doctor claimed that it was a autoimmune, sort of like a rheumatoid arthritis, type of disease, and which, of course, doesn't make a whole lot of sense that all 4 guys would come down with the same
Rheumatoid arthritis.
It wasn't rheumatoid arthritis, but one like that.
Right.
Autoimmune type of joint infection that caused the swelling in the spleen, liver. In other words, none of it. It didn't make sense when you put it all together. And then, of course, the results of it wound up to be the, obviously, the results show up the truth of it. So, as you're looking at that, putting the whole picture together, and as a doctor being willing to go against, in other words, not just being narrow-minded. Because I know that the blood test isn't completely accurate. So again, you're talking about a 60-70% chance of accuracy, and it always isn't where it should be. So you have to play detective, you have to see the results, and I was seeing the changes with the treatment that we were giving for the Rickettsia, and the treatments for the autoimmune joint problem was not working. So you have to look at that.
And it's important to know that he was a hunter, he had been out, it's really important to get their history.
Put the whole thing together, and then all 4 of them getting the problems at about the same time really puts a whole light on that. And then also just understanding the geography. I know that if you are from southern Indiana, southern Illinois, and you start to come down with a vector-borne infection, it's probably not going to be Lyme's, because Lyme's is not very common down there.
Right.
That is not the area
areas
that it actually comes in. Because when you're talking about Lyme's infections, I've had from my Lyme's infections have been from the East Coast or from Minnesota. And those are the centers of Lyme activity. So, again, putting that whole thing together, again, there are not that many infections of Lyme's disease in Indiana. So if someone has not been outside of Indiana and they have said that they've, got Lyme's disease, would be, there's probably 100 a year who come down with Lyme's disease here in Indiana. So it's not as common.
So if I've been bitten by a tick, and I kind of brought this up before, do I have Lyme's disease?
No. No, just because you've been bitten by a tick does not mean that you have Lyme's disease.
And remember, we just found a huge one on our dog.
Yes.
Oh, the vet said they'd never seen such a huge one. We couldn't get it off our dog, so we had to take the dog to the vet and get checked. But yeah, they they were proud of that huge tick. So what should be done if we find a tick on our body? What should we do?
Well, the first thing is to get it off as quickly as possible. The longer that it's on there, the more likely it is to spread infection. So getting it off, the best way to do that is to get a fine-nosed tweezers. Get as close to the skin as possible to contact the tick, and then just pull it off. Now, if some of the mouth parts are still in the in the skin, what you want to do is try to get those out and pull them out. Then, after you've got the tick out, what you want to do is put it in some alcohol, put it in a plastic baggie, seal it up so that you can have it identified what type of tick it is, and they can even check it to see if there's any infection in there. So it can be very important to keep that tick. So I would recommend that. And then you need to put some type of antiseptic over it, try to kill any type of infection, wash it with soap and water, and then you need to look and see if if you have any type of rashes, any type of symptoms that go along with that, and then of course let your doctor know that you were bitten by a tick. So that
it's really important to get those mouthpieces out. I know with our dog that was really important.
Sure, because that can lead to infection.
Okay. So at that point, would you recommend getting blood test at that point? If you know you've been bitten, if it's been identified as a tick?
Right. You can oftentimes they're not necessarily going to be accurate right at the beginning. It takes a little while for it to respond, but I would let your doctor know, bring in the type of tick, because different ticks are vectors for different types of infections. So if you're talking about Lyme's disease, many of the ticks are not able to carry Lyme's disease. So there is a very strong correlation between what type of tick and what type of infection you could have. There are about 8 major different types of infections, but when you're talking about vector-borne tick infections, there's a list of like 45. So there can be quite a few. So getting as much information along those lines is very, very helpful. One of the things that people talk about is, should they start antibiotics? It's recommended no. Center of Disease Control has said no, you should not start a round of antibiotics unless the infection is proven to, if you start to have symptoms. The reason is that antibiotics are overused and shouldn't be used lightly, and could cause more problems than help. Because antibiotics, if they are given to you, will cause a weakening of the immune system. And some of the infections that we would talk about that are transported by a tick are not susceptible to antibiotics, and you could be making the situation worse than better. So antibiotics, just having a prophylactic antibiotic treatment is not necessarily a good idea. Now, for the poor Plainfield girl, that just very sad along those lines, keeping that tick, what type of tick would be a very important type of thing. So that would be something that I would really recommend. Letting the doctor know right away any types of symptoms or signs, any types of fever, that would be something that would be showing up right away, and then should be addressed quickly.
Okay. When we come back, let's talk about the different approaches to treatment of this, the structure-function approach and the disease care model. Listen to the Voice of Health radio on your smartphone or tablet on all of the top radio apps available. TuneIn Radio, Stitcher, and iHeartRadio. You can find these apps and more on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. Laughter is the best medicine.
The doctor said, Dave, we're going to have to take out your prostate. I was like, why are you doing that? Take out my prostate. Typical doctor's answer, he says, well, while we're in there. While we're in there. Like he was going into the closet to get a jacket, Yeah, while we're there, we're going to grab a sweater. You don't mind, do you?
A special message from the DTS Weight Loss Center at the Prather Practice.
Are you tired of making the same weight loss resolution only to end up right back where you started? Let the professionals at DTS Weight Loss Center take all the frustration out of dieting. Our nutritionists and wellness coaches know what works for every body type and can develop a plan specific to your needs throughout your medically supervised program. Make the change by visiting us online at dtsweightlosscenter.com. Dedicate, transform, succeed.
When you call the Prather Practice to schedule your appointment at our DTS Weight Loss Center, mention the Voice of Health radio show and you'll receive a free initial consultation, plus a free body composition analysis. 317-848-8048. That's 317-848-8048. The DTS Weight Loss Center at the Prather Practice. Dedicate, transform, about shining the light on Lyme's disease. And Dr. Prather, let's talk more about the early signs and symptoms. I think of this toddler in Plainfield, just happened so quickly.
Sure.
So what signs and symptoms are we looking at?
For Lyme's disease, of course you have that bullseye type of rash. That occurs in about 70 to 80% of patients who contact Lyme. So it's not 100% on that. So one of the things, it does look like a definite bullseye. So you've got the center with a rash, and then you've got later a ring around it. You also get flu-like symptoms. You become tired, headaches, muscle pains, joint pains, and then the lymph system swells up. Later, as you go along, as you are into the next stage, is you get migratory arthritis. In other words, you get pain that travels from joint to joint without
joint pain.
Really any reason for it. You also have one of the things that's interesting on the Lyme's patients is oftentimes they'll get a Baker's cyst. That's where you get a swelling in the knee, where the knee kind of swells up on that. We had a patient who had Lyme's. That was one of the signs and symptoms. Also, you can start to get some heart problems. So there can be, it can start to damage the heart. It can also go to the brain, where there is some fuzzy thinking. One of the things also is people can kind of get a orangish hue in their hands. Because,
in their hands.
Yeah, because of the there is some breakdown of the lymphatic tissue, the lymphocytes, and so you start to get some changes in some colors. So putting those symptoms together is one of the best ways to diagnose Lyme's. Now, one of the problems with Lyme's is that there are several different forms of Lyme's, and some of them have different symptoms than others. So getting a good understanding of what all those symptoms are, and even then the different forms, so you can confirm that you have Borrelia. This is the most common, but different types of Borrelia produce different types of symptoms and respond to different types of treatments. So it becomes a really big problem. Now, one of the things is that a lot of people, because of the tick-borne types of infections in other different parts of the country that can occur, oftentimes the not accepted forms of diagnosing Lyme's right now, they will show up positive for that. So, but the treatments are completely different for each kind.
Right.
So it becomes in other words, you have to have really someone who's playing detective along these lines and finding out exactly what's going on. Like for the Rickettsia, you have a different type of a rash. And again, it's about 70 to 80% of the people. And that was one of the things on the Rickettsia patients that I was able to differentiate. It's because they didn't have the bullseye's rash.
It's not the bullseye.
Yeah, what they did is they had like little spots all over their body. And that was one of the things that really gave it away. So
a very different rash, yeah.
So, looking at that and understanding how that's going to be going on, but having those different types of signs and symptoms can really make a big difference.
Well, let's talk about how structure function care that we do here at the Prather practice differs in its treatment of infections.
The understanding the difference between disease care and structure function care in just generally is one of the big things, because as you're talking about, well, why does someone get the Borrelia infection and it becomes devastating, or someone gets the Rickettsia, the Rocky Mountain Spotted Fever, gets that and dies quickly, and one person doesn't? It has a lot to do with the body's resistance. So there's a formula that you put together is how much infection is coming into the body, first off, and then how able the body is to resist it. Now, one of the things that could occur is you could get multiple infections at the same time, which weakens your immune system. So if you happen to have caught some virus or other different types of bacteria, at the time that you get the infection, it's going to be worse than if you were a healthy individual at that point.
Right.
So what we try to do with a structure function type of approach is structure function does not attack the infection directly. What it does is it works on host resistance and complements the body to be able to go after the infection itself. So whereas disease care goes after the infection, or the signs, the symptoms that are associated with that. But all pharmaceuticals weaken the body's resistance. So again, if you were taking an antibiotic, your resistance, a normal 10-day type of cycle of antibiotics, your immune system takes 3 months to usually recover from that. So let's say that you had some type of bacterial infection a couple of weeks before you were exposed to this particular infection, and you took those antibiotics. Well, you're going to be weakened for 3 months to be able to fight something else off. So one of the things that we recommend for anybody who does have to take an antibiotic round is that they have some immune support, and you can cut down and modify and change some of the body's response on that.
Makes total sense.
So
you're going to build the immune system.
Building up the immune system and making sure it's in excellent shape is one of the things that we're really looking for. So not only were we trying to go after the infection, but at the same time keeping up the body's own immune system and ability to handle disease is one of the most important things that we can do. And that's going to be even more important as we go on. When I have a patient come in, it's very seldom that I find that someone has a healthy, active, strong immune system when they come into the office. Why is that? It's poor diet. We have a tremendous amount of exposure to chemicals. Stress will also have an effect along those lines. So having a healthy lifestyle is important to be able to fight off infections, and it really can make a big difference on if you are exposed to something like that, because people who have a healthy immune system and no other different types of infections usually will get over even Lyme's disease over a short period of time, oftentimes on their own.
And so people walk around and say, well, I never get sick. I must have a healthy immune system. That's why blood work's so important on an annual basis, and someone that can interpret it, not just looking for disease, but looking for the things that are throwing it off. We talk about homeostasis.
We had two people who, husband and wife, came in on checking on their immune system. And one of them was sick, and the other one, the guy was just getting checked. And she says, I'm sick all the time. And I said, well, there are certain reasons for that. So we went through those. And then we went through his blood work, and I says, your immune system's even worse. And they said, there's no way. Then that doesn't make any sense, because he never, catches a cold, fever, anything like that. And I said, well, there's different levels on how the immune system. If you're extremely healthy and you have a really strong immune system, you're going to kind of bounce everything off of your body because you're so strong you don't get sick. Then you have the people in the middle who their immune system isn't strong enough to really resist the infection. The infection comes in, but there's an immune response. So you have the fever, because that's an increase in the white blood cell count because the body's working hard. And then you have aches and pains as the body's fighting off the infection and defeating it. Then you have people who have no immune system, and they get in an infection, but their body's not even strong enough to respond. So you don't get the fever, you don't get the immune response, you don't get the inflammation, but the infection is going in throughout the body and causing damage to organs and further damaging the immune system.
And that was him.
So, he had other different types of problems. There was a lot of fatigue, there was other things, but he says, I never get sick, so, that must not be true. But he didn't understand what was going on, and when we tested for infections, he had high levels in his body of different types of infections. And as he was getting better, there was a response on the body. He had some fevers, as he was going through that process.
Right.
So understanding, the different types of levels along those lines, you need to be checked to really know what's going on.
So we talked, the structure function approach. How is that different than disease care?
Well, again, what you're looking for the structure function approach, and that can involve quite a few different types of things. Chiropractic acupuncture that can be on the structural part, which makes a big difference for how the immune system works. But then also on the body, are there nutrients that you are deficient of? Zinc is very important, just as an example for boosting your immune system. Your vitamin C levels, all those different types of vitamins, minerals, vitamin D can play a big role. So if you have a deficiency along those lines, that can be a big effect. How is your gut working? Do you have the normal gut flora that's going to promote, or do you have a bunch of parasites or bacteria, anaerobic bacteria in there that aren't good for you? So getting that whole thing, is your kidneys working? Is your liver working? Getting all those things normalized and back into normal homeostasis is basically where structure function comes in, whereas disease care deals with the symptomatology of the body. It reduces the inflammation, it attacks the infection, but usually weakens the immune system. So pharmaceuticals are dealing with a more short-sighted and immediate type of thing, whereas structure function's looking at more long-sighted and a longer-term type of difference.
Okay, when we come back, more on shining the light on Lyme's disease. Never miss an episode of The Voice of Health so that you can stay informed and empowered about your health. Get a podcast of our show automatically delivered to you every week by signing up for our show on iTunes. You can find that link on our website at thevoiceofhealthradio.com. And don't forget, thevoiceofhealthradio.com has complete archives of all of our past episodes with an audio library of information to help you add more life to your years and more years to your life. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather Practice. How is TMJ treated at your office?
One of the most important ones is actually some jaw adjusting. The technique that I actually use, I invented. It needs to be extremely light adjustment. If you come in hard on the jaw, it's a very mobile type of a joint. So the angle, the pattern, and just the amount of right pressure, it's a very gentle type of thing. As a matter of fact, people just sit there and say it's sort of like a puff of air. Did you actually do anything except, all of a sudden all their pain's gone?
Yeah.
Matter of fact, the TMJ is one of the major causes of headaches. There's a different pattern if it's cervicogenic and jaw on the headaches. By the time we do the consultation, I usually know where the headache's coming from. It also has a very strong emotional effect. There's actually a direct nerve that goes right to the brain from the jaw that goes directly to the emotional center in the brain. The emotions can affect the jaw, and then the jaw can affect the emotions. Jaw problems of any type of musculoskeletal pain, people commit more suicide from TMJ. About 80% of everyone's going to have TMJ sometime in their life. And many times people aren't even aware that that's where their problem's coming from. One of the things that you have to do is the neck has to be fixed to be able to fix the TMJ. If you don't get the top bone called the atlas fixed, you'll never be able to fix the TMJs.
And that's something you do. Your specialty is the atlas.
We actually have a specialty on that. So, but you can have TMJ problems and not have a neck problem too.
Okay.
But if the atlas is out, you're going to absolutely get nowhere with a TMJ. There's also a global type of a shift that occurs. The pelvis will actually shift. We've had people with elbow problems. We've had people with shoulder problems. And I said, it's coming from your jaw. And they're like, well, it doesn't hurt up.
How does that happen? Yeah.
And so I go up there and adjust their jaw, and I recheck their shoulder and their elbow, and I said, does that hurt anymore? And they go, no. Oh my gosh. I've had people working on this for 2 years and never gotten this far, and you do it in just like 5 seconds. Examination and diagnostics are absolutely so essential for really understanding a problem. If you don't know exactly what's going on, if you don't know what the cause is, then you can't fix it.
Right. And when you know, it makes the treatment easy.
Oh, yes.
Schedule your appointment at the Prather Practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope.
It's a beautiful day. Sky falls, you feel like it's a beautiful day. So let it get away.
You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where our mission is restoring hope to our patients. We're talking today about shining the light on Lyme's disease. And Dr. Prather, we do structure function care. That's what the FDA calls our type of care here at the Prather Practice. We have many providers, nurse practitioner, MD, chiropractor, occupational therapist, nutritionist. So we deal with the body holistically. We're trying to help the body maintain homeostasis or get into homeostasis, because when the body is in homeostasis, that is what health is.
That is the definition of health.
So why is structure function care so important in a post-antibiotic age? And we are a post-antibiotic age. People don't realize that.
Sure. And the problem is antibiotics are one of our precious resources. And we have abused our precious resources, and as we've done that, then we have created bacteria who are resistant. One of the problems with some of the forms of the Borrelia infection that causes Lyme's is that they are antibiotic resistant. So when you have that, and there has been so much exposure out there, in a very short amount of time, the bacteria are changing, becoming used to it, and sometimes the antibiotics encourage the growth of further bacteria. So with a post-antibiotic era, we need to be including structure function into our care on a regular basis. Matter of fact, that's one of the reasons that the Center of Disease Control feels that in the long term, having prophylactic antibiotic treatment after every tick bite would cause more harm than good, because it would be, one, setting a stage for more people getting antibiotics, and also some of the infections it would actually make worse. So, as you're doing that, then having that consideration on antibiotics and really keeping that under control is one of the things that's important. And so we need to be starting to think more in host resistance, which is us, than with treating the bacteria with an antibiotic.
Host resistance.
Host resistance. There's a reason why the bacteria was able to find a foothold. There was a reason that you have a urinary tract infection. There was a reason why you got sinus infections. And finding out what those reasons are and why the body is not working correctly. Once the body is working correctly, then you have a very strong resistant system, and antibiotics are used much less than what they should be.
Okay, I'm a bottom line person. The bottom line here is you keep your immune system strong.
Correct.
And then
And
you can resist many diseases.
The numbers of people who get antibiotics, only 20% of them are justified.
Wow.
That they should have gotten it. And one of the things that doctors say as they are presented with this material is, but my patient demands that I do something for them. Which is true. I'm sick, I want an answer. But if your hands are tied and you have only pharmaceuticals to work with, then you don't have a whole lot of options. So we need to open up. And our vision for healthcare is all primary care physicians should be structure function based.
But they're not being trained in school that way?
No. And that's what needs to be changed.
They have to do their own training.
You have to do their own training. There are programs now in some of the schools. Harvard is one of the ones who are in the forefront of doing that, of trying to think of more of for the primary care physician as a structure function based type of thing. Then when it is the 20% of diseases that do occur that require pharmaceuticals, then we send them out to specialists who know exactly what they're doing. So we're not talking about that structure function and disease care are in opposition to each other. Now, they are. Just because people who are on the structure function side say that the pharmaceuticals are wrong, and people on the pharmaceutical side are sitting there and saying, that's quackery. We have to go with pharmaceuticals. That's not the reality of the situation. There needs to be an integration of the two. 80% of all care should be structure function, and 20% should be disease care. And that's when we have the best of both worlds. I realize when someone comes into my office when they need a pharmaceutical, and we get them out to the proper people to get those, who are very aware of what's necessary to make that work. When they are on pharmaceuticals, people even need structure function more because their body's under greater stress. One, because of the disease process that has overwhelmed the system. But two, also now you've added pharmaceuticals which throw off the body even more. So keeping up with the structure function is extremely important to aid to get the best results with the pharmaceutical problem. It's one thing that they had found through experimentation. If you give the proper nutrients with an antibiotic, the antibiotic becomes 4 times more effective. Let me repeat that. What they found was that when you add certain nutrients in with an antibiotic, as you are taking an antibiotic, it is 4 times more effective.
Yeah.
Now, you need to be aware of which things to give and which things not, because sometimes some things interact with antibiotics. So it's a complicated type of thing, but we need to have people who are trained to understand and to know the differences and when to do what.
And I know for you, you had 3 years postgraduate study in the structure function model, analyzing diagnostics, 300 hours of just studying that. So I want to make sure we cover, what are homeopathics? How do they work in this? And I know we just have a couple minutes, but I want to make sure you get to cover what you need to.
Homeopathics are one of the secrets of the success in our office. We would not have been successful with the Lyme's and the Rickettsia patients if we had not utilized homeopathics. And what homeopathics do is, understanding what they are a vibrational medicine. And what they do is the Borrelia, one of its big problems is that it likes to hide from the immune system. And it's very effective at doing that, and it disguises itself. When you give a homeopathic Borrelia to the patient, what we found that it does, is it helps the immune system to identify what the problem is, and it goes, aha, there you are. It's like an unmasking. And when the immune system first off, the immune system has to recognize that is a foreign invader and that is the problem. And that's what homeopathic is really good for. But it's very important that we identify exactly what it is, because if I can't just give a general homeopathic, it has to be specifically for the correct infection for it to be effective. So I'm even more dependent upon proper diagnostics. I can't just give a broad spectrum antibiotic and expect the infection to go away. What I have to do is I have to identify exactly what the infection is, make the homeopathic for that particular infection, and then you start to see miracles happen.
It's interesting. It's like a war going on in our bodies, isn't it?
It absolutely is a war that's going on in our bodies and outside our bodies, and keeping the soldiers strong is one of our most important jobs.
So if someone listening out there suspects they have Lyme disease, what should be done?
They should try to find a good structure function doctor, someone who's very good at diagnostics, and really find out what the problem is, and make sure that they keep a good history. A journal would be very helpful, because you don't know what is what it is that's going to make the difference. And like one of my Rickettsia patients, what he did is his wife took a little picture of his stomach because he had a rash on it, and I could identify exactly what the rash, so I knew exactly what the infection was. If I hadn't been able to see that, I wouldn't have been able to know what to do.
Okay. Well, thank you, Dr. Prather, as always, shining the light on Lyme's disease. Thank you.
Thank you.
The Prather practice is located at 8902 North Meridian Street on the north side of Indianapolis, just south of the I-465 loop. If we can help you to achieve better health, we'd love to hear from you. Connect with our office at 317-848-8048. That's 317-848-8048. Join us again here next week or anytime on our website at thevoiceofhealthradio.com for The Voice of Health with Dr. Robert Prather. Are you frustrated by not getting to the root cause of your health issue? Are you tired of not knowing why you're always fatigued? Are you wanting to say no to toxic drugs? Have you lost hope? Are you just tired of being sick and tired? At the Prather Practice, we want you to know that we have the answers for you. We offer the alternative to the disease care model. We are the drug-free model to health and wellness. At the Prather Practice, we look for the underlying cause of your health problem and not just the symptomatology. Through thorough diagnostics, we find your individual health blueprint for your treatment. Where the disease care model is symptom-based, the structure-function model we practice gets to the root of your health issue. The Prather Practice is the most comprehensive wellness center in the Midwest. Our integrated practice offers you the most treatment options to restore your health and your hope. Learn more about the Prather Practice by calling 317-848-8048 or learn more on our website at thevoiceofhealthradio.com.